growing concern about KwaZulu-Natal's COVID-19 infection rate. The province has almost 93,000 active cases. The National Institute for Communicable Diseases says it's becoming hard to deal with the virus there. Let's speak to the head of department in KwaZulu-Natal, Dr. Sandile Tshabalala. He joins us now live. Thanks for your time, Doctor. Appreciate it. So how bad is the situation when it comes to hospitals actually having capacity to treat patients?
Good afternoon and good afternoon to the viewers. Look, the province is getting high numbers of COVID-19 on a daily basis. I think we were comforted today when we, for the first time after more than 7 days, received less than 5,000 new cases. But I think it's important that we say that our healthcare workers are doing all that is possible for us to cope with the increasing numbers, including also, among other issues, how we capture the active cases, the recovered cases, and all the assistance that we can give. Having said that, we must say that there are districts in our province which are affected more than others. And as such, you then find that in those districts, the number of available beds, one will speak on behalf of the public sector more than the private sector, although we're working with the private sector. The number of beds that will be available, therefore, in some districts will be less than other districts. And as such, we then have devised a strategy which is just a modification slightly on the strategy that we had devised of the resurgence plan and the festive plan, where we are saying if a patient needs to be admitted in a hospital, but is from a certain district other than where they live, that is where there is a bed, we are going to move those patients to those beds. We are looking at beds available, but every day, on a daily basis, literally, we look at available beds, bed occupancy in all the other institutions, hospitals, community health centers included, and we're availing beds. So far, we can say that we are able to admit patients that need to be admitted. We are trying to reduce those that are called the persons under investigation so that we also can be able to free those beds and be able to use them for isolation.
So, Doctor, let's talk about people being turned away, though, from hospitals because of a lack of capacity. That is happening. We've heard several people talk about how they go to one public hospital and they're told that there are no beds, and then they have to go and try and find another public facility. Why is that happening?
Now, let me just correct that. That is happening in the private sector. I have checked it. I have not heard it happening in the public sector. I also have said, and the MEC has said, if a person cannot find a bed in one institution, let that person be taken to another hospital within the public sector. What also we've experienced is a situation where a person in the private sector will call us and say, I would like to get a bed. And when they then don't get a bed in the private sector, they choose to go and find a chance somewhere else. But with us, our ambulance services will know that if there is no bed in hospital A, there is a bed in hospital B. So there is no way that patients will be moving around in the ambulances simply because there are no beds. That is how we've tried to structure the way we are working. That is why I mentioned earlier that if it means moving patients from one district to another, we will do that, because we will find that in that district there is an available bed and we move people around. But also we want to improve on our information and data management, because some of the releases, some of the recoveries, we think we're not doing very, very well in terms of recording them.
Doctor, I don't want to get into much details with this, but I personally know someone who was sent away from the Mahatma Gandhi Hospital to the King Dinizulu Hospital. So they had to find another hospital themselves. They eventually ended up at the Addington Hospital. But there are cases, despite your processes and what you say is supposed to happen, where people are being turned away at public facilities. And that's the worrying situation.
I would like to ask you that you get me the details of that person so that we follow up and see what was the reason for that to happen. Because if you have to be moved from Mahatma Gandhi to King Dinuzulu or to Addington or to RK Khan or wherever, you would be using an ambulance that is a government ambulance. And people within that ambulance would have communicated with different coordinators in the province to say, here is a patient who does not get a bed in this institution, where do we go? And therefore cannot be moving around in that fashion. I would like to get the final detail of that one, and we follow it up, as you are saying, there is a case that is a proof of it.
Yeah, it's happened already. The MEC spokesperson already addressed this issue with me, but he has the details and they've been in contact with this specific person. But let's talk about the broader issue at hand, and that, of course, is how you're handling, especially when it comes to nursing staff and other healthcare workers. We've seen so many people post on social media that they're struggling to cope. How are you dealing with these numbers at your public facilities? How are nurses and doctors dealing with it?
Look, we are worried about our frontline staff, all of them, not just nurses and doctors. Worried because the workload is exhaustive, but also they get to be infected themselves. And when they get infected, it means the numbers of people available to do the service decreases, further exhausting the others. We have employed other people, and we are looking at using the community caregivers. We are looking at also using the community service doctors, community service nurses to also beef up the staff and distribute them according to the need in the province. And we are doing that on a day-to-day basis as well, just to ensure that the whole system is coping, not only nurses and doctors.
And just one last question in terms of other facilities outside of hospitals and clinics that are being set up. Are you looking at re-establishing those? We know they were brought down after this first wave. Is that a possibility given your high numbers, almost 93,000 active cases?
I want to believe you are speaking to what we call the field hospitals and us using the BNBs and the hotels. In terms of the field hospitals, the 4 field hospitals that we had built, they were never taken down, and we are using them already. We took down Royal Showgrounds because the numbers were going down drastically there, and we also have started to refurbish it and reconstruct it such that it is going to be used according to our plan from Wednesday this week. We also have started to speak to different hotel groups to say, can we be able to use their areas as we've been using them? However, we're very cautious on that because we've seen that most patients who are admitting now need oxygen, and therefore we are preparing our institutions more than preparing the hotels and the field hospitals. But also in the field hospitals, we have reticulated for oxygen, we have put cylinders for oxygen, we are working with suppliers so that we have got enough oxygen and other necessary equipment so that we can be found coping with the numbers that are increasing. But as I said, we are hoping that 4,400 we got today is an indication that our numbers may be starting to go down in this second wave.
Yeah, let's hope that is the case. Thank you so much for your time and insight. Appreciate it. Head of Department in KwaZulu-Natal, Dr. Sandile Tshabalala.